Thank you so much, Nandi, for the sports update. Let's bring this now. Nurses have received deserved applause during the COVID-19 pandemic. However, the Hospital Association of South Africa says the challenges they face still need to be urgently addressed. The association has written an open letter on matters it feels must be highlighted, and these include nurse shortages, deteriorating working conditions, as well as the transition to new nursing qualifications. CEO of the Hospital Association, Dr Dumisani Bomela, joins us now with more details. Dr. Bomela, thank you so much for your time and good morning to you. Let's talk about the urgent need to not only address government through this letter, but also the urgency you say a solution needs to come to play. Why did you feel a need to actually write this open letter now?
Thank you so much for having me. Good morning. So I think the letter comes out of a desperate concern for us as major players within the health sector. We have really noted the deteriorating situation in terms of new nurses that are coming into the system that are being trained. The training numbers having decreased. And where we start with in the open letter we wrote is by acknowledging the nurses and their role. And coming out of the last 2 years during COVID-19, I think everyone knows the tribulations of nurses as a profession and the sacrifices they made, and having paid the ultimate price in the line of duty in many instances. And all of this, all the problems that we observe in nurses are underpinned by the fact that they are overworked. And they are overworked because there is a shortage. Now, it goes beyond the considerations directly for nurses themselves, but the people that must receive care from the nurses. And for a long time, we've been trying to address this with the authorities and other stakeholders. It's not finding traction. And we feel that it's getting to a desperate situation. And the purpose of our open letter was mainly to sensitize all stakeholders, like you are saying, to do what they can to resolve this problem.
So because you're saying it seems they're not coming to party, they are not meeting these concerns with the urgency needed, what's the way forward? Because I had a conversation with the young nurses in Daba a couple of weeks ago, Doc, and what they said struck out. They said government not coming to party is making nurses complacent to murder. Then what's the alternative if people are dying, if people are not receiving the care they need from nurses, but also nurses are saying there are other issues that inform the dire state in our hospitals?
On one hand, we are appealing to the authorities, but also more importantly, we are putting it out there that as private hospitals, which is the constituency that I represent, we have capacity, massive capacity to train nurses, but there are obstacles and administrative and regulatory obstacles from the side of the authorities that are preventing us from fulfilling that goal. If you look at around about 2015, 2016, the private sector was training the majority of the nurses that are trained in the country. But that has now slid back because of various reasons, which we are saying need to be addressed.
Right.
The bottom line is there is capacity to train. The private sector is ready and willing, knocking at the door as it is. And we are appealing to the authorities and any other stakeholders that can assist in this regard.
All right, Doc, we have to leave it there due to time, but I appreciate you speaking to us. Dr. Dumisani Bomela, Hospital Association of South Africa. That's the CEO of the organization, of course, talking to us about an open letter that he wrote, of course, sensitizing all stakeholders to this dire state of our nurses in the country.